Hello, friends going to Ukraine.
Hi, Jacqueline Qualter.
Tyler Jackson.
So Tyler is paramedic and head of our operations here at LoginClinics. And since you're going to Ukraine during this time right now, we definitely want to have you prepared with some knowledge that you can use. We hope that you do not have to use it, but in the event that you do, we want to impart that knowledge to you. Tyler is a trained educator in CPR, American Heart Association, and so a component of that is first aid. So just wanted to go over not all of first aid, but maybe like the parts of it that you might need over in Ukraine. So what do you have there on your table, Tyler?
Well, decided to bring you guys just some basic knowledge of hemorrhage control, anything that you could possibly encounter while you're over there. Stuff that would be more pertinent to what you would possibly see. And just starting off with the basics, like a small injury going up to something that is more severe, and what ways you can control that and hopefully help save someone's life in the process.
Yeah, I think that maybe they might have like some of these things with them. So like this is
Yep. So we got a cat tourniquet here. Now I don't know if you guys what type of first aid equipment you're going to have, but more than likely you'll have some type of bleeding hemorrhage control device that's going to be in there. One of the main ones that's out there is the cat tourniquet. This is well known throughout the military field, also in EMS companies. We also have something that you might not have in there, but it's worth showing it to you because if you do, it can be very resourceful. It's called an Israeli Ibd Dressing. This serves a purpose as an ace bandage and also a tourniquet too, if used properly.
So the biggest like worrisome thing I think that we're talking about is like bleeding, like managing bleeding and loss of blood.
Right.
So I think they probably are going to have some of these things with them. So do you want to show
sure.
how this works?
Yeah, absolutely. Now we'll start off with just the basic. I'm sure you'll have some type of gauze that's going to be in your kit. A 4x4 is a great one to go for just because it's going to be big enough to cover most, superficial type of injuries. But of course, with anything, you're going to want to make sure that you're putting pressure on whatever area that's been injured.
Yes.
Of course,
pressure is good.
Pressure is good.
Yes, pressure stops bleeding. You don't just want to like dangle it on there. You want to pressurize it,
apply
right?
firm pressure.
Yes.
Absolutely.
Yeah.
By doing that, once you've applied pressure with your gauze, a lot of times they're going to have different size cling. This is like a 2-inch cling that I had handy laying around. So I'm just using this as an example. But you're going to keep pressure with the 4x4 and then use the cling to wrap around the 4x4. Okay. And you're just going to continue to do this until you've gone through the cling. Now, let's say this is something that's needing more pressure to it.
Like what if the bleeding doesn't stop, kind of a thing, because there's veins, there's arteries, right? So if we've hit a vein, this should work with like not much pressure.
Yeah.
But if we've hit an artery, then we might need more pressure.
Maybe we need to turn this into a tourniquet, right? So maybe we don't have a cat tourniquet or an Israeli Ibd Dressing available. Okay. We need to make do with what we got. So what we can do is we can use the cling here. We can take a pin, a stick, whatever's laying around, wrap that around it once and twice. We'll go one more time. And then once we've wrapped that around, what we can do is we can start twisting.
Ow. No, I'm just kidding. It doesn't hurt.
We can start twisting
but
this.
That's a lot tighter.
It is.
Yeah.
Until it cuts off circulation and stops the bleeding. And pretty much you want to keep twisting until the bleeding has stopped. And then once you've got it into the position that you want to keep it in, then you continue to wrap around it some more. And once you've gotten to the end of this gauze, you're going to want to tuck it or try to tie it the best you can to keep it in place and maintaining that pressure. So that's a good makeshift.
So important too that you're on the right spot.
Yes.
Because if you're too low or too high, it could still bleed despite however much pressure you have. So you definitely want to be on the spot that is bleeding.
Absolutely.
Yeah.
Absolutely. Belts also, of course, those are always, things that come in handy in a situation like that. If you have a belt available, you can use that as a tourniquet. I'll switch over to this cat dressing right quick just to kind of show you how simple it is to use. And typically with these types of tourniquets, you're going to go 2 to 3 inches above the wound, right? So with the clean dressing that you have here that you're putting over the injury, you want that directly on the injury, right? And you're going to go ahead and do your makeshift tourniquet if you need to stop the bleeding, right? But let's say that you have a cat tourniquet and you do have blood that's just spurting out, right? You can't control it by pressure or anything else. You're going to
Or
want
like some sort of injury, if like a hand's cut off or
Yeah.
something like that.
if you got amputation.
You wouldn't go there, you'd go above.
Absolutely. You want to go at least 2 to 3 inches above where that injury's at. If you had your hand amputated, I mean, you're definitely going to want to go up to at least forearm. I mean, I would just
Not bending areas,
Yeah.
'cause that's like not good.
that's too much there.
Yeah.
If you want to go forearm there, that would be ideal for an amputation. But the cat tourniquet, like I said, super easy. It's Velcro, right? So you're just pretty much just putting the limb to where, let's see, and then
That's like the
tightening.
pen. That's like the pen you had.
That's
kind of,
exactly right. That's exactly
And
right.
you can use this on legs.
So this is, I mean, what's great about a cat tourniquet is that you can expand it to whatever size you need.
A lot of room here.
A lot of room that's left over.
Waist?
Waist, yes, there is waist, but that's okay.
Okay.
You
No,
know,
I mean around your waist.
around your waist, no.
Okay. I don't know.
Yeah, no waist, no head, you know,
No neck.
no neck.
Okay.
Yeah, no neck.
That makes sense.
Those are the areas you
Yeah.
don't want to tourniquet off. But once you put it to where you need it, then you want to start tightening up like we did with the pin, right? So
before you pull this through, you tighten it?
yep. So
Okay.
we're gonna tighten this to where the position that we want, and then you can see right here that it latches in to this little bracket here,
See that, yeah.
right? Very easy. And then once you've gotten that, then you can go ahead and you can figure out what you want to do with this. You can wrap it all the way through again. That's fine. And what the key thing with this is you want to write down the time that you apply this, because that's good for the hospital whenever you get them to where they need
Yeah,
to
because
get
you're
to.
cutting off, if there is some like tissue down here, you're cutting off blood supply, artery,
Right.
which is
Circulation.
oxygen, nutrients, so things can die like distally.
Absolutely.
So definitely want to know how long that's been on there.
That's right.
But we want to keep blood, definitely want to keep blood, right?
As much as we can.
As much as we can.
As much as we can.
Yeah.
Now, and just touching base on this IBD dressing, this Israeli battle dressing, like I said, it's like an ACE bandage, you know, so a lot of folks are familiar with that. But what's cool about it is it has an abdominal dressing already sewn into it.
Like a gauze kind of.
Like a gauze,
Yeah.
right? A gauze with its own 4x4 sewn into it. So, you know, we're doing the same with this. You know, we're putting it on the injury, right? Applying pressure.
Is this considered a tourniquet too? Like you
So
said?
that's what's cool about this is that if you use it correctly, it can turn into a tourniquet, kind of like how we turned in the clean into a tourniquet, right? So you can wrap this a few times.
It always has to go through this little hook.
Exactly. Yep. Okay. And
You have to
then-
do the whole thing? Oh,
Pardon?
just a cut. You don't have to do the whole thing. You're still twisting
Well,
it.
so what we're gonna do is just like we would for this, you know, once we go through a few times, then we can wrap or we can flip to go to the other side. I'm sorry, let's do this.
You're tight here before you even like twisted it.
Right. So we can go opposite
Ah,
direction
Okay.
and pull the opposite way.
Which
and-
feels like a tourniquet.
Yeah, which feels like
Yeah.
a tourniquet, and it provides a lot more
Wow.
pressure onto
Yeah,
that
it's like,
area.
it's even pressure
Mhm.
versus like the twisty pen was
Right.
more like centered. Wow.
So, and then you
Okay.
continue to go all the way through, and it's got little clamps on the end that go. I'll let go quick.
Thank you.
Her hand's turning purple.
It is.
Yeah. So
This is my favorite. I think this is the best one.
the Israeli battle dressing is great. This was tested by military first, and then they pass it on to civilians. So it's very effective. But just in case you do have that in your kit, that's good to know, good to use. Comes in handy. Remember, try to keep mark of the time or track of the time that you applied one of these, and then get the individual to the hospital as quick as they can.
So that's like, massive bleeding, stopping the bleed fast, because obviously if you are bleeding a lot, you are going to lose a lot of blood. So we want to stop as much bleeding as we possibly can. How can you tell if something is like an arterial bleed or a venous bleed, or like, does it matter?
Yeah. So typically with your arterial bleeds, they're going to be spurting bright red blood. That's just going to be pulsating out. That's your key factors that you want to be looking for. If it's, a slow oozing trickle, dark colored type of blood, that's usually your vascular, your venous system. So those are the type of blood, injuries that you can typically control just with pressure, light pressure and bandaging. But the ones that are spurting out, those are going to be the ones that are more difficult to control.
So the ones that are spurting out, then the arterial bleeds, we can infer. Do you put the bandage right there, or do you go a little higher?
Well, depending on what you got, right? So, I mean, if you have something like this or basic gauze, you can put that on there, right? And then turn it into a tourniquet. But you're typically going to need a little bit more than that if you have it available. So let's say you use this to tourniquet off right there, and it's still not stopping it. Then if you have a belt, if you want to try it up a little bit further
Go
up,
higher.
go higher.
Yeah.
So-
Yeah, that makes sense to go a little bit higher, because if you can stop the artery from bleeding versus not on it, but like a little bit higher, because you're going to be using a lot of pressure.
Absolutely.
So, okay, so we covered like blood loss, venous injury, arterial injury.
Yeah.
And then, I think those are like the kind of worrisome things. I think another worrisome thing would be just, being unresponsive. What do you do if somebody's unresponsive?
Well, it's unresponsive, it just depends on the situation. Of course, make sure the scene's safe for you. So if there's, a scene safety issue, then try to take the individual out of that environment as quick as possible. But if you know that you're safe as well, then you're going to want to, you're assessing for pulse. You want to, if they are breathing, you want to turn them onto the side, in case there's no aspirating, if they are vomiting or anything of that nature.
That's
So
kind of like CPR. So we're kind of getting into like the beginnings of CPR.
there's a lot of different stuff that goes with that. I mean, other small good bits of information that could be helpful would be taking care of fractures. Let's say there's an injury, someone breaks their arm, their wrist, some type of, if it's a clavicle, then, there's things that you can do to help relieve pressure and to provide better stabilization so that they don't re-injure the area more, right? So if you do encounter that, let's say there's no bleeding, but someone's broken their forearm here and you can see obvious deformity, maybe even the bone sticking out, I don't know. But in those types of situations, you can use whatever's close by. So if you have
Cactus.
so the cactus.
We were
yeah.
joking, like, what do we splint with? The cactus. No, like
Got to be resourceful.
you need
right?
like some sort of splints, right?
Right.
So like
something.
flat.
So whether it's, I just got a can here, so I can just put a can, or we'll use Jackie's arm. So we can just do a can here. And a lot of times what you want to do is you want to have it so that the hand's kind of like over in a comfortable position, whatever it is. So if you have something that can go up further, cool. If not, no big deal. But you don't want to impinge too much on where any joints are at, right? Because you want to still allow them to have mobility so they can put it in a position of comfort.
So maybe like that.
But yeah, so if you want to keep that there, and then you wrap it with some gauze to keep that secured there. And a lot of times when someone breaks like a forearm or even like a clavicle, what we'll do is we'll splint it and then we'll provide them with
Like
a sling, right?
Yeah,
So
to
we'll push the arm closer into the chest, right? And then we'll have like, just, you can take a shirt. We use a triangle bandage on the truck, but what you can do is you can just put it around the limb, have it go under their arm, and you tie it up around their neck. And that way it cinches to their chest, and it allows them to kind of just relieve pressure to their arm and just relax it.
Yeah, because the more movement there is on some sort of injury like that, the more you're risking more bleeding, more swelling, maybe a dislocation, more injury to the vessels that are in that area, because you don't know, you could injure not just bone, but vessels. So
Absolutely.
Stabilizing,
Yep.
Any musculoskeletal injuries,
Yes.
if you can.
Mhm.
So what else do we need to talk about if we're going to Ukraine?
Well, unfortunately, I mean, you might encounter gunshot wounds, you might encounter shrapnel from explosions, and those types of situations, if there's any type of gunshot wound, there's always the risk of multiple, well, not multiple, well, it could be multiple, but insertion and exit types of wounds. So, when you see someone that has been shot, or if they have like some type of penetrating wound, check to see if it's a through and through, excuse me, if it's gone, on one side and out the other, or if there's no exit wound that you can find, right? And in those types of situations, it's all about hemorrhage control again. Same thing.
Yeah, splinting,
right,
wrapping, controlling bleeding.
If there's
Ice. If you have ice.
I mean, if you have ice, yeah, that's great for, swelling, for areas that are, that are discomfort from maybe a fracture. you know, it's more so about hemorrhage control, of course, when you've been injured with, you know, an object. So of course, elevation, wrapping, pressure, that kind of stuff would be necessary at that point.
Yes.
If there's an injury that involves somebody being impaled, where let's say they have an object that's stuck into their arm, right? Don't try to remove it. Just leave it in
leave
there,
it in,
right?
yeah,
Leave it
until
in
they
there.
get to the hospital.
Maybe you can even wrap some cling around it just to secure it, to make sure that it doesn't wobble around or anything, right? So I would recommend leaving that in place until you get to a facility, because you don't want to take it out and it's stopping the bleeding. You know what I mean? It's severed an artery, but you don't know that until you've taken it out. So in those types of circumstances, just leave it in.
Okay. Well, I think you've pretty much covered the basics, the scary basics, I guess. And I think everyone knows about like basic first aid, like, you know, cleaning the area, like abrasions.
If you can,
and,
yeah, absolutely.
yeah, with some soapy water
Yeah.
and covering it up. So, well, thank you so much for sharing your
Thank
skills
you.
with us.
All right.
Very skilled.
Thank you.
All right. And have a safe trip, guys.
Safe travels.
All right. Bye.